Hi, in this video, we'll discuss cardiovascular disease and coronary artery disease. Cardiovascular disease, abbreviated as CVD, is a class of a disease that affects heart and blood vessels, including mostly coronary artery disease, CAD, peripheral artery disease, and cerebrovascular disease. CAD develops when the major blood vessels that supply heart become damaged or diseased. Patients with CAD are characterized by the accumulation of atherosclerotic plaque in the coronary artery, with major consequence of an acute myocardial infarction. CVD includes, in fact, CAD, such as angina and myocardial infarction, commonly known as a heart attack. This is a cross-section of artery showing a fat deposit. In both conditions, with CAD and CVD, there is a narrowing or blockage of the coronary arteries. It's usually associated with build-up and progression of fatty deposit inside the arteries that may cause atherosclerotic cardiovascular disease. Fatty deposit inside the artery consists initially of ApoB containing lipoproteins, in particular low-density lipoprotein, and driven by an active inflammatory process in focal area of arteries. Fatty deposits are mostly made up of cholesterol, fatty substances, cellular waste products, and calcium and fibrin. This is a healthy cross-section of the artery. Here we have artery and there is no plaque formation. Please keep in mind that atherosclerosis is a multifactorial chronic disease sustained by different risk factors, such as dyslipidemia, arterial hypertension, and diabetes mellitus, smoke, and etc. Once these risk factors are established, there is initiation of a deposit of fat, where the plaque form in lining of the artery. Next, the plaque grow and progress, and more lipid core is accumulating inside the artery. Once this progress more, lipid core and fibrous cap forms what we call it a venereal plaque. The fibrous cap will rupture, and at this moment platelets will try to repair the artery, forming blood clot. The end stage, blood clot forms. This clotting can block the artery, limiting blood flow and oxygen to the heart, thus leading to a heart attack. Of note, the combination of a fibrous cap and a big lipid core is known as thin cap fibroateroma, which is the hallmark of a vulnerable plaque. To end, inflamed thin cap fibroateroma is the most shared forms of the so-called vulnerable plaque and account for 70% of acute coronary thrombosis event. To end, for more insight about physiopathology of vulnerable plaque characteristic and other feature, please have a look on my recent review. Thank you for your attention, and we'll see you in my next video.